So as many of you know, Belgium is also a federated state. So we have the federal government and we have regional and communities. The screening programs are mixed competence. So we, federal, state, and the regions have to do that together. That means you have to bring ministries together. And what in Belgium they created for health is what they called an interministerial conference. And that conference has a number of working groups where representatives of the different responsible ministries are participating. And the screening project, the screening programs for cancer, they fall under the Intercabinet Working Group Chronic Diseases and Prevention. It's within that framework, I think already for about 3 years, we're discussing on what exactly we will do to implement HPV testing into the cervical cancer screening. And we managed to come to an agreement with all the parties at the end of March last year. And it was decided that we would transit from screening by cytology to screening to HPV testing. There was, as we realized that this is a major change, they wanted us to, they wanted an action plan on what all need to be addressed. And they wanted us to focus or try to set up an implementation plan over 2 years. We said from the beginning that was not realistic, but they said, okay, make it 2 years, because if you make it 5 years, it will never happen. So it was more a political decision to have it in 2 years, so we will take the time that is necessary to implement it. There was a strong demand to restrict the testing to a limited number of centers. There was a preference for having only one validated HPV test, with the explicit demand that the test should also allow for self-sampling. We should develop our approach on an evidence-based level, and there should be a joint communication, federal and the regions, to the professional field and the general public. This was all decided by and accepted by the Interministerial Conference on the 26th of March 2019. Mark Arbein has been key player in that, in providing all the necessary evidence, and he constantly updated a document that was transmitted between the different players. And the document is for internal use, but Mark told me that there will probably be a scientific publication with the contents of the document that will then be open to all public. Now, this was 2019. In the meantime, that was a document that more or less listed all the actions that were in there, and we were preparing that, and we had the experience with another intervention on introducing next generation sequencing in the oncology diagnostics to use the roadbook concept. And the roadbook is it's a plan, it's a type of plan where you have a large number of actions that need to be addressed and that need to be implemented, where various number of players are involved and that proceed at different speeds. So that's why we decided to keep a roadbook and not a very much a plan structure, because it's more flexible. And there are 14 actions that we want to address. First of all, you need a technical committee to monitor the implementation. We wanted to have a discussion, whether the regions really wanted to have a discussion on the general organization, because it might be that in the different regions they want to do it differently. Although there was, in the last meeting that I had with the administration, a common feeling that it should be the same. We needed an action on the criteria for laboratory selection, on the selection of the HPV test, on the purchasing, because in Belgium, we don't really have at the federal level a tendering procedure. We have it at the regional level, but we need to define how we will do the purchasing of the HPV testing. Financing was an important element, although we think that there will be a serious reduction in cost if we implement HPV testing. The quality, the QA/QC framework, both for cytology and HPV testing, needs to be addressed, a surveillance plan. And there was a strong also support for linking, or at least addressing, screening and vaccination together. The triage needs to be looked at. There will be a central registration that will be linked both to the cancer registry and via the health data environment. As our colleagues in the Netherlands addressed already the issue on communication, this was a thorough discussion point already, how we will communicate the HPV, the shift from cytology to HPV testing, and also taking in consideration the vaccination. There was a discussion on HPV negative cancers. We should address the nature and etiology. Self-sampling should be included. And there is the strong support for having supporting and participating international initiatives. So these are the 14 actions that are in the roadbook. We will have each of the actions will be led by a representative of an organization that is key in that. And each will have an action plan, and it should be integrated so that within, let's say, a reasonable time, we come to the implementation of the HPV testing. The coordination of the roadbook will be in the Cancer Center, and we will constantly be in interaction with the Intercabinet Working Group. We had, since March, some discussions already with policymakers, but as we had elections in May 2019, and there is still no federal government. The regional governments are in place, but the federal government is not there. We were a little bit waiting on green light to continue, but we had already also consultations with the professional groups, the pathologists, gynecologists, the general practitioners, and the virologists, microbiologists, and all are now on the same track to start moving from cytology to HPV testing. The governance of such an initiative, I'm not going to go in detail, just to give you an impression. There's a hell of a lot of organizations that will be involved, so it will be a very complex situation, a very complex intervention to manage. But we have the experience already at the Cancer Center to do that, so I'm pretty convinced that this will work out well. Now, as we are, let's say, more than 1 year waiting, I discussed with the Ministry of Health, can we not really start something at least? And they said, well, you could already start thinking about selecting testing and look for a QA/QC program, and also think about the budget, because that will be the first element that probably will pop up in the discussion. Once we start with the new federal government and the new regional governments, what will it cost? And in fact, apart from COVID, which I do not know what the impact will be on health in general and let's say our economy in Belgium and in Europe, the main bottleneck for us is that there is no federal government. And as far as I can see, we had all sorts of solutions. It's a very complicated exercise because the distribution of the political parties or the two regions is very diverse. We have Vivaldi, that is some kind of consortium that may be formed. We have a king, then we had the three kings coming up. So I hope that there is a deadline, because the current government, the federal government is in place till the 17th of September. What will happen then, we don't know. But as soon as there is a federal government, I think we will be able to proceed.